Welcome to the show. Today we're going to talk about Medicare. Did you know that once you've selected your Medicare or Medicare Advantage plan, that there is a time where you can make changes? And that time is now. Today we have a representative from Elderplan, and he's going to give you some information on the open enrollment period. Please listen and take notes, and maybe you might want to revisit your plan and select something that's more fitting to your lifestyle. Autumn is here. Hello, everyone. Welcome to Autumn is Here. I'm your host, Francine Crawford. And we have, again, Mr. Frank Polanco, from Senior Vice President of Health Plan Growth at Elderplan, here again to talk about Medicare. Welcome to the show.
Thank you, Francine. It's a pleasure to be able to be back again, talking to you and talking to your community. Elderplan is a not-for-profit health plan that's a member of the MJHS Health System. You know, my team and I, we're in the community all the time, help tens of thousands of seniors with their Medicare choices. We could talk health plans all day, every day, if you'd like. I look forward to this conversation around the Medicare open enrollment period and to future conversations about Medicare and Medicaid, if you'll have me.
Oh, absolutely. Absolutely. So before you explain the Medicare Advantage open enrollment, let's tell the audience a little bit about your background and what Elderplan is.
Well, Elderplan is a not-for-profit health plan. Like I said, a member of the MJHS Health System. We help folks choose Medicare Advantage plans. I've been here since 2008. Like I said, in the community, we help tens of thousands of people, every year with their health plan decisions, answering questions, educating about Medicare, educating about Medicaid. We have multiple plan products. And, we compete out there in the market with all the big health plans that you may or may not be familiar with. But we're here to give we try to really focus on our community, on our diverse community. And we're in the community every day with our RVs and with our manpower or woman power, talking to everybody.
Oh, okay. Well, last time you were here on the show, we were speaking about Medicare annual election period. Can you tell us what makes Medicare Advantage open enrollment period different from that?
Well, the open enrollment period, or OEP as we call it, is really for people who are having sort of buyer's remorse. Maybe they chose a plan during AEP and they realized that maybe it wasn't the right plan for them. So to be eligible for this election period, you must have been enrolled in a Medicare Advantage plan on January 1st. And what this election will allow you to do is to either switch to another Medicare Advantage plan or to switch back to original Medicare if that's what you want to do. Now, during this period, from the 1st to the 31st of March, from the 1st of January to the 31st of March, only one change will be permitted during this period. And any change that you make will become effective on the 1st of the next month. So, for instance, if you enrolled in Elderplan today, February 5th, you would be effective in our plan on March 1st.
Okay. But you would have already have a plan by January 1st.
Yes, you would have had to have chosen a Medicare Advantage plan for January 1st.
And now this is a point where you can change if there was something that you found that didn't work for you or something like that.
Absolutely. Maybe you discovered that, this doctor that was very important to me is not in a plan, or I just found out that there's a new medication, it's too expensive, whatever it may be. There's a host of reasons why someone might have buyer's remorse, but this would be your opportunity to make that change. Okay.
So that's the time when you make all the changes for a Medicare coverage for Medicare Advantage program.
Correct.
And that ends on March 31st?
Yes, ma'am.
Okay, and then you're stuck with that for a whole year, and then you can change again.
Well, yes. I mean, there are some exceptions to that, but for most of the population, yes, the next opportunity to make a change would be the next time we have AEP on October 15th to December 7th, which would be the annual election period.
Okay, so Medicare Advantage, you have all these different companies that say they have this or have that. Are they all following the same rules? Like all the people who have Advantage and they have these programs that they can pick from, are they all following the same guidelines for the state that you're in?
Well, the guidelines are set by the federal government. So CMS, which is our governing body, the Centers for Medicare and Medicaid Services, they determine these election periods and they create special election periods. But yes, we are all following the same rules. And for the most part, we are all offering the same benefits. They might be at different levels. There might be some additional benefits that they offer, but for the most part, we're all offering similar benefits. The guide is that we have to offer what original Medicare offers and make it a little better.
Okay. So you have a leeway. The companies have a leeway in offering different tools or things for the patients and things like that.
Absolutely. We all cover the benefits a little bit differently. Some folks might have co-pays, some folks might have co-insurance, which is a percentage of the cost. Some costs might be higher, might be lower. The additional benefits might be different. So yes, we all have leeway in offering benefits, at different levels. That's why it's very, very important for beneficiaries to shop and see what plans make the most sense for them.
Okay. And like when you're making a decision, I mean, this could be confusing, and some people may have approached this, but they're a little confused about it. Is there 4 things that you can tell me that would help the viewers to be able to think about before they choose this?
Well, some of the most important considerations when choosing a health plan, are your doctors in the network? Whether they're your PCPs or your specialists, make sure that your preferred doctors are in the network. I know, my mom or my dad, I mean, that's really the most important thing to them. They want to have a doctor that they feel comfortable with. Costs. I mean, can you afford the cost? I mean, each plan has some plans have a monthly premium. Some might be 0, some might be 30, 40, 50. Can you afford that monthly premium? And the copays, how much is it going to cost to go see your primary care physician or your specialist? Are your prescription drugs in the formulary? Each plan has a formulary of drugs that they cover. You should make sure that your drug is in that formulary. And what additional benefits are available? In the community right now, OTC is a buzz. It's a card that folks can go into pharmacies or and they could buy groceries sometimes. They could get non-prescription health-related items. Plans are offering a lot of money on OTC, so that it might be important. Vision, hearing, dental. Do you need dental work? Some plans offer comprehensive dental, some just offer preventive. So it's important to understand what additional benefits are available. And I would add a 5th thing, and I would say that you would hope that the plan aligns with your values. Elderplan, for example, is a not-for-profit health plan. It's a member of the MJHS Health System. It cares for, it supports, and guides diverse communities throughout New York. So it's an example of, is the plan aligned, with your values?
Okay, so if you were having some difficulty in doing this, you would just call the company. Is there a certain set person who's going to do that and help these people able to understand the program to be able to select what's best for them?
Yes, we have here at Elderplan, we have licensed benefit advisors who, if you call Elderplan, we will send someone out to your house if you'd like, or you can come meet us in the community and we'll explain all the options to you. And as I drive around New York City, I see a lot of health plans. They have offices in the community. You can call Medicare, Medicare.gov is an awesome resource. You can put in your circumstances, your doctors, where you live, and they can give you plan recommendations also. So there are plenty of resources out there for people to understand Medicare and specifically what options are available to them during this open enrollment period. And Francine, if you would allow me, I'd like to just go back for a second, because right now the open enrollment period is very important. And we talked about, AEP coming up, but folks should also know that there are special election periods, throughout the year. And if you have a qualifying event, like maybe if you move out of this area and the plan that you're currently in is not covered in that area, or maybe you qualify for Medicaid, but certain qualifying events will allow you to have a special election so that you can make a change before AEP. And that's another reason why you would call a plan like Elderplan, to kind of like guide you to see if we can help you find one of those special elections in your circumstances.
Oh, okay, okay. Now you say a lot about being in the community, going in the community. How do you go into to the community? Do you align with other hospitals? Do you do fairs and health fairs? Do you have mobile units? Like, how do you go reach the people in the community?
All of the above. I'm glad that you asked. Yes, we have 40 licensed Medicare benefit advisors who are out in the community every day. We have community outreach vehicles. There are our mobile offices, and we're very, very excited to announce that we're out in the community right now, looking for brick and mortar areas in the boroughs to have community offices so that we can have our members come see us, in the communities that they live. So all of the above. We do health fairs. We do screenings in the community. We work very closely with community doctors. We believe that the community doctor is a very important part of the health of the healthcare system, and we want to work with them and align with them and work with their patients. So all of the above.
Okay, that's awesome. That's awesome. So you're reaching out. You're reaching out to the community. That's awesome. And this is nonprofit, correct?
Correct. We're part of the MJHS Health System. We've been servicing the community for over 100 years now. Elderplan has been doing Medicare Advantage for over 30 now.
Awesome. Awesome. Oh, that's great. That's a lot of great information, just to help people along when they're trying to do this open enrollment plan. But is there anything else that you think that we should know that may help people along this journey?
The most important thing I'd like to say to your audience, Francine, who has Medicare, is to examine your options. There are many different options, and the options change every single year. Each plan changes their benefit offerings, and it's important and people's situations change. Maybe, 1 year you need a new medicine, or 1 year you might need a new doctor. I mean, you need to check your benefits every single year to make sure that they're aligned with your needs. And there's other plans out there, and they're eager to speak to you. Most plans will have someone come out. I know Elderplan would absolutely have one of our benefit advisors come to your home, explain everything to you. There's no reason to be stuck in a plan that doesn't suit your needs. Please make sure you shop.
Oh, that's awesome. That's really something that we should know. Sometimes people don't know, and they don't want to bother people. They don't want, and they can't get out, so they just don't do it, and it's good to know that you would come out if they gave you a call. So that's great. That's great. Thank you so much. Thank you so much for interviewing with us again and giving us this information that's going to help the community and help people who are going through this, and elder people. And I really appreciate it, and I appreciate your time. So thank you again. And it's really valuable information that you shared with us. And thank MJHS for you coming out here and talking about Elderplan. We really appreciate that.
No, thank you, Francine, and thank you for this service really that you're providing, because so many people can use this information. I look forward to any opportunity in the future to come and provide any information I can to you and your community. Thank you.
Oh, okay. All right. Well, take care. Good night.
Okay. Bye-bye now.